And I'm going to start by, now that I've introduced myself, by introducing our first speaker, Dr. Ashley Smith. So Ash is going to talk to us about the potential of technology in health, especially healthcare, including aiding in diagnosis, improving treatment and enhancing care. Ash will share some examples of where technology has enormous potential when we look forward to the future. And so Ash is an early career neurophysiologist whose research is positioned at the nexus of neuroscience, exercise physiology and cognitive ageing. In 2017, her research excellence and outstanding community engagement in science was recognised with the South Australian Tall Poppy Award. Ash was really instrumental in having early discussions with us as we started to build this exhibition, so it's a real pleasure to have her with us tonight. Welcome, Ash.
Thank you so much for that kind introduction. Yeah, it's great to be here tonight to talk about 4 things. So I've got 10 minutes to talk to you about 4 things that I believe we have strengths in South Australia, and also that I believe will be important for future reality of health. So without further ado, the first 2 things I'd like to talk about is virtual and augmented reality. So virtual and augmented reality, we know, can both change our perceptions of the world in vastly different ways. So in virtual reality, we can create worlds and we can take a person from this room and have them experience a world outside of this room. But what it does is it leaves that person blind to what's happening in this room right now. The other technology that I'd like to talk a little bit about tonight is augmented reality, which is like, it's been explained to, virtual reality is like going swimming with sharks, whereas augmented reality is bringing different perceptions into this room, into your world. So it would be like as if a shark appeared out of the screen towards you guys, just to use a Back to the Future reference. But who better to talk a little bit more about the differences between virtual and augmented reality than a Pepsi ad. And I really like this, this particular ad, and hopefully it'll load. I don't have any sound on it. So you get the idea from this ad how augmented reality in this case can be used to sell Pepsi. But let's talk about how these technologies can be used to improve healthcare and improve rehab. And so one project that's is underway at the moment at the University of South Australia is using virtual reality to improve rehabilitation for people with chronic pain. And there's some key features about virtual reality that really make this a really exciting potential. So it's immersive, it's motivational, we can add gamification so we can keep people engaged in rehabilitation a little bit more. We can get visual feedback, give visual feedback to the people on how they're progressing in their rehabilitation. we can motion track them, we can send data directly to the clinicians. And then something else that we're working on is we're improving the exercise experience for people with using virtual reality. So there's a certain group of people who don't enjoy exercise, and we're using virtual reality environments to try and improve the exercise experience there. So virtual reality has a vast potential in the future of health and rehabilitation. This is another project that I'd like to quickly talk to you about that I'm involved in at the University of South Australia. My background, I'll just get the video running whilst I talk to you a little bit about this. Some of you may have had an opportunity to have a look at this technology out in the foyer. My background is in neuroscience. I use a particular technique called transcranial magnetic stimulation, which is this technique here. And one of the biggest problems we have is being able to accurately guide stimulation. So I started talking to Dr. Ross Smith at the University of South Australia, and we're improving the accuracy of guiding stimulation for patients and participants in our research studies by directly projecting somebody's MRI image directly onto their brain. So that's one way that we're using augmented reality technology to understand a little bit more about the brain. We started off with this because I was interested in improving my research outcomes, but there are a lot of other opportunities for this. And future opportunities may be to pair augmented reality stimulation with guiding treatment of, say, some MRI-guided cancer treatment, for example. So I know I don't have a lot of time, and I always like showing robots where I can. I was recently in the USA last week, and I went to a conference, the Alzheimer's Association conference, and at this conference I got the opportunity to play with this little guy. So these are robots that are being used for dementia companions. So for people living with dementia, and there is sound on this. Sorry, there shouldn't be. So these robots have tactile sensors on them, so people with dementia can touch the robots, and the robots will move and respond to their stimulation. One of the other really cool features of them is that the robots modify their behaviour based on AI software, and the robots themselves show some really great emotion. I think this picture captures it all. Yeah, I was ready to take this robot home and trade it in for my dog. And finally, in the last couple of minutes, this is not something that I'm involved in, but I think it would be very remiss of me not to talk about it in a Future of Realities for Healthcare talk. This is a Flex Flinders driverless shuttle. So this bus is a driverless bus, and you can actually book a ticket to go and sit on this bus. And there's huge potential for this for older people, for example, people who are currently housebound, unable to get out and be social. So driverless transport is a huge area where people are considering improvements in the future. I'd just finally like to wrap up with whenever we design new technologies, we need to have some considerations for these technologies. So are we creating technology that people actually want? Are we talking to our target audience, and is this something that they actually want? To use an example from the driverless bus, I was talking to a sociologist recently who said actually driverless buses will remove the one thing that isolated older adults don't have currently rely on their bus driver for, and that's a social interaction. So if we remove that bus driver who keeps an eye on older people, then what are the implications for that older person? So we need to start thinking about these when we're designing new technologies. In terms of the dementia robots, will we lose the human connection? Will robots replace that connection? And that's a really important consideration for technologies. Are there other ethical considerations? I'm sure we've all seen those movies. I guess they're things that the researchers and future health professionals and future technology professionals need to start thinking about and continue thinking about. And then also, particularly important for South Australia. How are we going to train the next generations of leaders in this space, and how do we best design our university courses and our training programs to train people up in health as well as technology? So they're just my considerations for new technologies. I hope to hear some more thoughts in the Q&A session from the audience. So thank you very much.
Thanks, Ash. I like your question around, we're designing technologies people want. It sounds like such an obvious question, but so often the design of technology starts with this would be cool. But this would be cool and useful, I think, is a better kind of lens to put on that. And I also thought the point you make about how are we designing that with users. So we were conscious when we designed Mod that we did that with our target audience. And I like the way that you're thinking about how do you actually involve the dementia patient, how do you involve the person that you're trying to provide the service for in that. And then I'm curious also to pick up that thing about how real are the realities. If you exercise in virtual reality, is it worse than exercising in nature? Not if you do more exercise. I think there's lots of really interesting questions. I'm one of those people that doesn't particularly like exercise. I'm not sure that I would do it in a virtual or a real world. So just sort of picking up that question about how real are those other realities, and how are we blurring that line between the digital and physical space, which people have been talking about for 10 to 15 years, but actually seeing some of those examples makes it a little bit more real for us. So thank you.